Hello everyone. In this session, I am going to teach you meningitis. But before understanding meningitis, it's important to understand the structure of central nervous system, that is CNS. In central nervous system, there are two things. The main composition of the CNS is the parenchyma, and the coverings of the central nervous system is known as meninges. So, you can see in this diagram the central nervous system composed of two things, the brain and the spinal cord. So here you can see this is brain and here you can see this is spinal cord. So let's talk about the parenchyma. In the parenchyma, three types of cells are present. The most important cells are the neurons. Neurons are the most important neurotransmitter cells. The second type of cells, the supporting cells to the neurons, are the neuroglia cells, which are of three types: astrocytes, oligodendrocytes, and ependymal cells. And the third type of cells, that is the macrophages of the brain, are known as microglial cells, the third type of the cells. So here a rough sketch diagram you all can see. In this diagram you can see this is the brain and this is the spinal cord constituting the central nervous system. So three type of cells compose the parenchyma. That is neurons, the most important, the neuroglia cells, the supporting cells, and the microglial cells. Now, let's talk about the coverings. There are three types of coverings. So, what are the three types of coverings? The three types of meninges over the central nervous system: Dura mater, arachnoid matter, and pyometer. So, there are three types of meninges in the central nervous system. Now, let me tell you the sequence from outer to inner of the three types of coverings or the three types of meninges. In this diagram, you can see this is brain and spinal cord and this is the skull. You can see this is the skull and the vertebra. Now, between the skull, vertebra and brain and spinal cord, the three meninges are present. So, let's see their orientation and sequence. The most outermost is the dura mater. It is just below the skull. So, you can see just below the skull, here is the dura mater. Can you see? This is the dura mater. Just below the skull, it is the outermost one. The innermost is the pyometer. Can you see? Here is the pyometer. It is adhered to the brain and the spinal cord. So there is no space between brain and the pyometer or between spinal cord or the pyometer. It is closely adhered with the CNS parenchyma, the innermost. So dura mater is the outermost, pyometer is the innermost. Between the two, the middle one is the arachnoid. The middle one is the arachnoid. So if I say the sequence from outer to inner, from the skull to the brain and spinal cord towards CNS, the sequence is dura mater, the outermost, arachnoid, the middle one, and pyometer, the innermost. So these are the three types of the meninges or covering. The same you can see here and the same sequence you can see here. If you see here, this is the bone, the skull bone I am talking about. So this is the skull bone. Just above the bone, just above the skull bone, there is periosteum, there is aponeurosis, the fascia, and this is the skin containing the hairs. Now see the meninges, the sequence from outer to inner. Can you see? The outermost is the dura mater, the middle one is the arachnoid, and the innermost is the pyometer. And just below that, it is the CNS parenchyma. So this is the same diagram showing the same sequence. Now let's talk about the meninges a little bit detail. The outermost, the dura mater, it is a tough fibrous covering. The outermost covering, it is tough and fibrous. It is closely attached to the skull on the inner side of the skull. And let's talk about the spaces. Basically, there are two spaces related to dura mater. One above dura mater, that is between skull and dura mater. One below dura mater, that is between dura mater and arachnoid. The space above dura mater, that is skull and dura mater, is known as epidural space. And the space which is below dura mater, that is between dura mater and arachnoid, is known as subdural space. So epidural space and subdural space, one is above the dura mater and one is below the dura mater. The two type of spaces related to the dura mater. You can see the diagram here. You can see the red color covering is the dura mater here. Now see the two spaces. The above space, the yellow color space. The above space, it is epidural space between the skull and the dura mater, and the below space, the green space between the dura mater and the arachnoid, it's subdural space. So you can see the yellow and green, that is epidural and subdural, the two type of spaces. So that's all about the dura mater and spaces related to them. Let's talk about the other two meninges. What are the other two meninges? The other two meninges, that is pyometer and arachnoid. These are the other two meninges. They two combinedly called as leptomeninges. They are very close to each other, and combinedly the two, that is pyometer as well as arachnoid, we call them as leptomeninges. Out of them, the pyometer is attached to the brain, and the arachnoid lies between the pyometer and the durameter, the middle one, right? Now let's talk about their spaces. As I have told you, pyometer is closely attached to the brain. So there is no space between the brain spinal cord and the pyometer. But there is a space between the pyometer and the arachnoid, just below the arachnoid. That's why this space is known as subarachnoid space, because it is below the arachnoid and it contains CSF, the only space which contains CSF. So in this diagram, you can see the space between the pyometer, this is pyometer, and arachnoid. The space, the blue color space, that is subarachnoid space, and it contains CSF. It contains CSF. Now, if you got the orientation about the meninges, the spaces related to them, let's talk about the topic meningitis. Let's talk about the topic that is meningitis. So, meningitis, you can see itis. Itis. What is itis? Itis is the inflammation. So, inflammation of the meninges is known as meningitis, inflammatory process of the meninges. Now, if meningitis, the inflammation occurs of durameter only, it is known as pachymeningitis and it is less common. But if inflammation involves pyometer and arachnoid, these both always involved together because they are very close to each other. So if the inflammation occurs of the pyometer and arachnoid, it is known as leptomeningitis and it is more common. So pachymeningitis is less common and leptomeningitis is more common. So in pachymeningitis, basically the durameter is involved, and in leptomeningitis, basically the pyometer and arachnoid are inflamed or they are involved. So if I am saying meningitis, by default I mean this because it is more common. By default I mean leptomeningitis. So in this diagram, you can see the inflammation in the coverings, the pus formation in the coverings, that is meningitis, right? It can involve any part of the brain because meninges are present all over, right? Now, the meningitis inflammation is there. For causing inflammation, there is infection. Infection causes the inflammation. For causing infection, there must be a microorganism. So bacteria can cause meningitis, viruses can cause meningitis, and fungus can cause meningitis. So these are the various microorganisms which can lead to infection of the meninges leading to meningitis, right? So the point is that the question is that what is the route of entry of these organisms, how these organisms are reaching up to the meninges and causing the infection. So what is the route of infection? The most common route of infection is the bloodstream. If any of these organisms, the bacteria, virus or fungus is present in the blood, if there is sepsis in the blood, if any of this organism is present in the blood is going everywhere. So blood is going in the meninges also. So via blood, they can reach up to the meninges and causing their involvement, causing their infection. The most common route. The second route is directly from the adjacent focus without involving blood. So just suppose this is the brain. And near the brain, various structures are present. We have skull, which is very close to the brain. We have eyes, nose, ears, very close to the brain. So if any microorganism or infection is present, any of these organs, the microorganism can directly invade into the brain from the eyes, nose, ears, skull without going to the blood. It can directly go to the meninges of the brain and causing infection, right? So that is adjacent focus infection. And the third is the iatrogenic. What do you mean by the term iatrogenic? Iatrogenic is physician-induced, doctor-induced or physician-induced. What do you mean by that? There is a procedure known as lumbar puncture. In lumbar puncture, the doctor, the physician introduce a needle in the subarachnoid space which contains CSF. You can see here the needle is introduced. The needle is introduced into the subarachnoid space containing CSF due to two reasons, either diagnostic or therapeutic. So in diagnostic, we take out the CSF. From this needle, in the syringe, we take out the CSF for examination of the CSF. And in therapeutic, we introduce some of the drug. We introduce some of the drug into the CSF, right? So that is the lumbar puncture. So while performing lumbar puncture, if the physician, the performing person is not taking care of asepsis, not taking care of sterile conditions, so via needle, the organisms can be introduced directly in the CSF and that can lead to meningitis. It is known as iatrogenic one. So there are three routes: the bloodstream, the adjacent focus and the iatrogenic. Via these three routes, the bacteria, virus and fungus can reach the meninges and causing inflammation of the meninges, that is meningitis. Now let's talk about the types of meningitis. The most important, there are three types of meningitis. The first caused by the bacteria, the pyogenic bacteria, the pus forming bacteria. So the pyogenic or pus forming bacterial meningitis is always acute. That's why it is known as acute pyogenic bacterial meningitis. It is caused by bacteria, the pus forming bacteria. The second one is caused by viruses, not bacteria, but viruses. It is also acute. Viruses also cause acute meningitis, but this time in the CSF lymphocytes are raised. Virus do not cause pus. That's why the viral one is not pyogenic. It is acute lymphocytic viral aseptic meningitis. And the third one is the chronic, not acute, chronic. Chronic is caused by one bacteria and one fungus. What is the name of the bacteria? The bacteria is Mycobacterium tuberculosis and the fungus is the Cryptococcus fungus. So there are two types of acute meningitis and the last one, the third, is the chronic meningitis. The first acute is bacterial pyogenic. The second is viral lymphocytic aseptic and the third one is the chronic. In the chronic there is one bacteria, one fungus, you know the names. So that is the three type of meningitis. We have to see their details one by one, how to differentiate them based on their CSF finding. We collect the CSF of the patient and see the 7 findings in the CSF. Based on those 7 findings, which we differentiate which type of meningitis is it, right? So let's talk about the first type of meningitis, the acute pyogenic meningitis, the acute bacterial meningitis. So can you name the bacteria? Which bacteria causes it? So it depends on the age of the person. Age of the person. Up to 1 year of age. Up to 1 year of age, it is caused by Streptococcus, group B Streptococcus bacteria. From 2 months to 3 years, from 2 months up to 3 years, it is caused by Pneumococcus. From 3 years till 20 years, it is caused by Meningococcus. And from 20 years onwards, it is again caused by Pneumococcus. So you can see based on the age of the patient, the bacteria are differing, right? All of them are pyogenic bacteria, right? So either it can be Streptococcus or Pneumococcus or Meningococcus, depending on the age of the person, the bacteria is different. So that is the etiopathogenesis. Coming on the clinical features. Bacterial meningitis is a medical emergency. So the patient presents with high grade fever, severe headache. The patient will have vomiting, drowsiness, coma, occasionally convulsions. The most important clinical symptom is stiffness in the neck. The patient will complain to the doctor that, doctor, when I do forward bending, I am having typical stiffness in the neck. So typical stiffness in the neck on forward bending, it is a very important clinical feature. Now name some sign. The most important sign here is Brudzinski sign. What is Brudzinski sign? So if you are suspecting the meningitis in any of the patient, so just bend, just flex the neck of that person, of that patient in which you are suspecting the pyogenic meningitis, the bacterial meningitis. On flexing the neck, the patient will have involuntary flexion of the knees and the hips. So a positive Brudzinski sign is on flexion of the neck, the patient have involuntary flexion of the knee and the hip joint. So it is considered as a positive sign. So we have seen the symptoms, we have seen one of the important sign, right? Now this table is going to be master table, in which now this table is regarding the CSF findings, which can differentiate the 3 type of the meningitis. Right. Now in this table you can see the normal CSF findings. You have to compare the normal with acute bacterial, acute viral and chronic meningitis, based on which you can differentiate the 3 type of meningitis. So we will study the 3 type of meningitis in detail based on their CSF findings, and in the end we will see this table. We will compare it, right? Let's start the first one, the acute pyogenic meningitis. So we have to see the 7 features. What are the 7 features? The first thing, see the appearance. Before I tell you the features in the 3 type of meningitis, I would like to highlight the normal CSF findings. If you know the normal CSF findings now, it's easy for you to understand the 3 type of meningitis CSF findings, right? What is normal color and appearance of the CSF of a healthy human being? In a healthy human being, the color of the CSF, there is no color, it's colorless and it's absolutely clear like water. So CSF is clear and colorless like water in normal healthy human being. What is the pressure? Normal pressure is 60 to 150 mm of water. You should know the normal pressure is 60 to 150 mm of water. Does normal CSF have cells? In a healthy human being, does CSF, my CSF, your CSF or any healthy normal human being, does it have cell? Yes, it is having 0 to 4 cells. Which cells? Lymphocytes. Only lymphocytes, not neutrophil. Even a single neutrophil is abnormal. Please mind my words. Even a single neutrophil in CSF is abnormal. So CSF can have few lymphocytes, up to 4 it's normal. More than 4 it is also abnormal. What about the protein content? CSF have protein 15 to 45 milligram per deciliter. It is normal protein. What about glucose? CSF have glucose, normal CSF. It's 50 to 80 milligram per deciliter. And normal CSF have no bacteria, no virus, no fungus. It is sterile. So if you know the normal findings, now you have to compare in various type of meningitis. So we are talking about the first meningitis, that is acute pyogenic bacterial meningitis. So what is the color and appearance? So it is cloudy or pus or purulent in appearance. It is thick. So if you collect the CSF, it is not like water. It is very thick. It is like pus, the thick CSF. Purulent, it looks like cloudy. That is about the appearance. So based on appearance only, you can have a guess, you can have a suspicion that this is purulent meningitis. Right. The second is the pressure. If you measure the pressure, it's more than 180 mm of water. Normally, it's up to 150 mm of water, and it's more than, slightly more than the normal. It's up to or more than 180 mm of water. In acute bacterial meningitis, we are talking. If you take the Newbar's chamber and see the cells and count the cells, you will find abundant of neutrophils, many neutrophils in the CSF. I told you even a single neutrophil is abnormal. So here you will get abundant of neutrophils, 10 to 10,000 neutrophils. You will get 10 to 10,000 neutrophils. Normal CSF have 0 to 4 lymphocyte, not even a single neutrophil, 0 neutrophil. But here 10 to 10,000 per microliter neutrophils are there. The next is the protein. Normal CSF have up to 45 milligram per deciliter of the protein. Up to 45 it's normal. But here it's more than 50. Why the protein content is more? Have you ever thought? So this is the CSF you are collecting from a patient having acute pyogenic meningitis. So it contains the bacteria. All bacteria have cell wall, whether it is gram positive or gram negative. All bacteria have cell wall. Cell wall is made up of protein. So the bacteria, the cell wall of the bacteria contributing to the protein content of the CSF. Now, if you measure the protein content of the CSF, it's more than normal because it contains the cell wall of the bacteria also. So the protein content is higher. It's more than normal. Next is the glucose. The glucose concentration or sugar concentration, it's lower than normal. It's lower. Normally, it's 80 milligram per deciliter, up to 80 milligram per deciliter, 50 to 80. But it's less than 40 here. Why? Because if the patient have acute pyogenic meningitis, the bacteria present in the CSF consume glucose as a nutrition, as food. So glucose is consumed. The sugar is consumed. So that's why it's low. So in the bacterial meningitis, the protein content is more and the glucose content is less. Protein is more because of the cell wall of the bacteria. Glucose is less because of the the glucose is consumed by the bacteria as a nutrition. The chloride content is always less. You have to learn. And lastly, if you do the gram staining, the special stain, the gram stain, you will find the causative organism either gram positive or gram negative. It can be Streptococcus, Pneumococcus or Meningococcus. So these are the 7 findings based on which you can do the diagnosis that this is a typical case of acute pyogenic bacterial meningitis. The most important point among the 7 is the cells, the neutrophils, right? So this is the CSF finding. Now you can see the Newbar's chamber. This is the microscopy of a patient, the CSF of a patient in acute pyogenic meningitis. I can see most of the cells are neutrophils. The nucleus is multilobated. So most of these cells are neutrophils. They are neutrophils. So it's typical microscopy of CSF of acute pyogenic meningitis patient. Let's talk about the second type of meningitis, the viral meningitis. So it's acute viral meningitis. It is lymphocytic because here the cells are not neutrophils which will rise. The cells which will rise will be lymphocytes. And it is aseptic because no bacteria is present. So this one is the viral. What is the etiology? The most common virus which leads to viral meningitis is enterovirus. Apart from which there are many other causes like mumps, like ecovirus, Coxsackie virus, Epstein-Barr virus, herpes simplex 2 virus, arthropod-borne virus or HIV. These are the other causes, but the most common is the enterovirus. That is the etiology. Clinical features are same as that of bacterial meningitis, but it is relatively benign. It is self-limiting and complete recovery is possible. It is not a medical emergency like the pyogenic one. But the patient will have same clinical features like fever, headache, vomiting. That's it. So that is about the viral meningitis. Now we have to compare the acute bacterial, acute viral with the normal. Right. Now the first point is the appearance. Here the appearance is clear. There is no pus. If you see the CSF, it's clear like water, clear, colorless, or maybe it is slightly turbid, but not purulent and cloudy like the bacterial one. It's clear like water, like normal only. So based on appearance, you cannot make a suspicion, right? If you see the pressure, it's more than 250 mm of water, right? You have to compare with normal. Normally it's 150 mm of water. It's more than 250 mm of water. See the cells. Here you will find lymphocytes. Normal CSF also have lymphocytes, but the count is 0 to 4, and here the count is 10 to 100. Here its count is 10 to 100 cells per microliter. So the most important finding is the cell. The next is the protein. Protein is normal because viruses don't have cell wall. So if you take the CSF of a patient having viral meningitis, so the CSF contains the virus. But viruses don't have cell wall like bacteria. So if you measure the protein content, it's same as that of normal. If you see the glucose content, it's also normal. It's also normal because viruses don't consume sugar or glucose as a nutrition like bacteria. The chloride content is reduced here also, and if you apply the bacteriology, it's sterile. If you apply the gram staining, it will be negative because it is not caused by bacteria, it is caused by viruses. So bacteriologically it is sterile. So these are the 7 findings based on which you can make the diagnosis that it is a typical case of acute viral lymphocytic meningitis. Now compare and contrast it with the bacterial one, right? This is the microscopic picture of the CSF of a patient of viral meningitis. CSF of a viral meningitis. What cells you can see? Most of the cells you can see here, they all are mononucleated cells, they are lymphocytes. So the count is 10 to 100, 10 to 100 per microliter. So these are lymphocytes. Now if you remember that slide, in the bacterial one, most of the cells were neutrophil. Here they are lymphocytes. The third and the last type of meningitis is chronic meningitis. As I told you, chronic meningitis, it is not acute. This one is chronic. The last 2 we have studied, both were acute. One acute bacterial, one acute viral. This one is chronic. Chronic is caused by one bacteria. The name of the bacteria is Mycobacterium tuberculosis, and one fungus. The name of the fungus is Cryptococcus. So basically there are 2 types of meningitis. Tubercular meningitis caused by Mycobacterium tuberculosis. It is common in children, and cryptococcal meningitis. It is more common in immunocompromised persons such as AIDS. So cryptococcal meningitis is an important cause of meningitis in patients with AIDS, or patients on chemotherapy, or patients on steroid therapy, right? So these are the 2 causes. Clinical features are almost same. It's headache, confusion, malaise, vomiting, but it is not a medical emergency, right? It is a slow processing, slow clinical features are there. It's chronic one. Now again, we have to compare the chronic meningitis CSF findings with the normal CSF findings, right? In the end, we will compare all 3. Let's talk about the appearance, color and appearance. If you take the CSF in a test tube from a patient having chronic meningitis, and if you keep it on in standing position for few hours, for few minutes, you will see at the bottom, a fibrin web is formed. A fibrin web, a web is formed, a fibrin web. It is known as Cobweb appearance. It is typically seen in chronic tubercular meningitis. Tubercular meningitis, it forms the web. That is the appearance. The second is the pressure. So CSF pressure is more than 300 mm of water. Normally, you know it's 150 mm of water, it's more than 300. The third is the cells. If you see the cells, again, they are lymphocytes. They are lymphocytes and few macrophages. So lymphocytes, but the count is 100 to 1000. In viral meningitis also, there were the lymphocytes. But if you remember the count, it's 10 to 100 in viral one. And here it's 100 to 1000 in the chronic one. And the unit is same, it's per microliter. So here also it's lymphocytes and macrophages. Protein content is raised like bacterial one because Mycobacterium tuberculosis and Cryptococcus, the bacteria and fungus, both have cell wall, and cell wall is increasing the protein, and the glucose content is lowered. So same like bacterial one. So this is a CSF of a patient having chronic meningitis. If you collect the CSF, it contains either the bacteria Mycobacterium tuberculosis, or it contains the fungus, or else it contains the fungus, that is Cryptococcus. So both of them have cell wall. So protein content is increased both of them, and both of them can consume the glucose as a nutrition. So glucose concentration is less as compared to normal in both of them. So protein is elevated and glucose is lowered. You have to understand that. The next point is the chloride content, which is always reduced, and the special stain, if you apply the special stain for Mycobacterium tuberculosis, the special stain is Ziehl-Neelsen stain, that is ZN. Ziehl-Neelsen stain, also known as acid-fast stain. Acid-fast stain, AFS, acid-fast staining, right? And for Cryptococcus, the special stain is negative stain, that is Indian ink preparation. So see the two types of stains. Can you see this is ZN stain and this is India ink, the negative stain. The negative stain. ZN stain, we can see Mycobacterium tuberculosis as red color rods. Red color rods. The Mycobacterium tuberculosis are red color rods. And in Indian ink, it is a negative stain. What do you mean by negative stain? In negative stain, we stain the background. We don't stain the organism. See, the background is black color and the fungus is transparent. So a transparent organism stands out on a dark background. That is the concept of negative stain. One of the negative stain example is India ink. So you all can see the fungus is standing out. This is the Cryptococcus fungus, the capsulated fungus. It is standing out on a dark background. So these are the special stains. So that's all about it. Now in the end, this is the master table. You have to compare the three type of meningitis, the features of three type of meningitis, the CSF finding in each of them with the normal. With the normal you have to compare. Now first you compare the acute, bacterial, acute, viral and chronic. These are the three type of meningitis. Compare each of them with the normal. Now first you compare the appearance. Normally the appearance is like water, clear, colorless. But in acute bacterial it's purulent, pus, purulent and cloudy. In acute viral again it's clear and colorless like water. In chronic one it is the web formation. It is the web formation, fibrin web formation, cobweb appearance. So based on the appearance these are the findings. Based on the pressure. Normally pressure is 150 up to 150 mm of water. In bacterial it's above 180. In viral it's above 250 and in chronic it's above 300. See the values. Normally it's 1 to 150 up to 150 mm of water. Up to 180, up to 250 or above 300. So that makes a difference. The most important finding is the cells. Take a Newbar's chamber, see the cells and count them. Normally cells are 0 to 4 but lymphocytes normally. In bacterial one it's 10 to 10,000 but not lymphocyte, it's neutrophil. All of them are neutrophil. Maximum of them are neutrophil. In acute viral again it's lymphocyte but the count is 10 to 100. 10 to 100 lymphocyte. Normally they were 0 to 4. Here it's 10 to 100 lymphocytes. And in chronic one it's 100 to 1000. Again it's 100 to 1000 but again lymphocytes. Again lymphocytes. What about the protein? Normal protein content is 15 to 45 milligram per deciliter. In bacterial it's raised. In viral it's normal. In chronic again it's raised. The reason for raise of protein is the cell wall. Viruses don't have cell wall. That's why there is no raise. No raise. Now the next is the glucose content. The glucose content. The glucose content normally is 50 to 80 milligram per deciliter. In bacterial one it is drastically reduced. In viral one it's normal. It's normal. And in chronic one again it is reduced. So the reason is that the organism is consuming glucose as a nutrition, yes or no. So you can see the glucose and protein findings are same in bacterial one and chronic one. But both of them are normal in the viral one. So you have to compare all the findings. In the end, you have to apply the special stains. So normally it's sterile, but here on gram staining you will find the organism. The viral one, you will not find any organism here. And in the chronic one, you will do ZN stain for the Mycobacterium tuberculosis and Indian ink preparation for the Cryptococcus. So based on this, you can make out the type of the meningitis. This table is a master table from which you can get many MCQs in your exam, and you can write the long question, short question also on this. So this table is really ultra important for the meningitis. Thank you very much.